As it was mentioned, I'm just going to give you some very high-level highlights about the project activities, our outcomes so far, and then, as you can see from the program is designed in the way that you learn about each of our steps much more in depth when you will hear from the practical experience of our partners how the implementation of this project looks on the ground. Before going into the objectives themselves, I just would like to underline that for us the main rationale for this Scirocco exchange project, which stands for capacity building support for integrated care, has been this notion that we are lacking the tools, frameworks, and some sort of supports for the delivery organizations in their journey towards integrated care. And more importantly, the key driving force is that the integration agenda has been very much localized, so local context really matters when you prepare and implement the integration of health and social care services. So we've been looking actually back since 2014 if we can prepare some kind of practical tools for delivery organizations to help them on this very challenging journey. So that has been our starting point. In the project we worked with a really diversity of healthcare organizations, as you can see from the slide. Countries coming from different healthcare system organization, different culture in integration agenda, different organization of integrated care, and also different progress and maturity in integrated care, which actually enriched the project. So driven by this diversity of partners, we've actually set up the target or the main objective for us to provide a really personalized and tailored support reflecting on this maturity and this diversity of local conditions in integrated care locally. And the main driver for this capacity building support in the project has been this Scirocco Exchange Knowledge Management Hub, which is an online platform which serves basically on the basis that the users, mostly the health and social care authorities, can input their needs, their gaps, and also priorities for integrated care, and search through the hub if there is already any evidence, any learning, any good practice that they can learn from and inform their local conditions, particularly through the activities around the knowledge transfer, which then ultimately should lead to the improvement of local conditions. So this has been the cycle that we've been going through in the project, and I will just very briefly introduce each of these functionality of this hub to set the scene for the sessions that come afterwards. So just choosing the first functionality and the maturity assessment, so as I was saying, is really critical for for the journey towards integration, that you understand conditions that enable or on the other hand hinders your progress in integration. So for that purpose, building on the outcomes of previously funded project by health program Scirocco in 2016, we have developed a validated tool, online self-assessment tool for integrated care, which functions, as I said, as a self-assessment. So the objective is not to evaluate if any integrated care initiatives are doing well or not, but really to capture how people see the transition or the progress in integrated care. The tool is free to use. It's online, so everyone interested can use the link provided on the slide and test the tool themselves. As you can see, it consists of 12 dimensions. So each of these dimensions reflects particular efforts you need to put in place for your successful implementation towards integrated care. And the main idea is that this tool helps you to understand your maturity. So how far did you go with your integration? And we do so by providing assessment scales against each of these 12 dimensions, ranging from 0 to 5. So if you go through all of your 12 dimensions, all your 12 questions, you will end up with these visualized outcomes in the form of spider diagram, which quickly gives you kind of like a quick detection of where you are doing really well. So what are your success factors, what are your successful local conditions in place, but on the other hand, more importantly, what are your gaps, so what should be your priorities for the future improvement. And you can use this information in various circumstances. You can use it to capture, as I was saying, the perceptions of particular stakeholders, so you can do this assessment with your team or within your organization. And the tool helps you to visualize very quickly how different stakeholders think of the progress towards integration. Where we've seen the biggest added value throughout the duration of actually both projects was that you use this tool to bring all these different stakeholders together. So you use the Scirocco exchange tool as some sort of a basis for the discussion. So that's where you bring all these different perceptions together, but actually ask them to agree on the final maturity, so agree on your future priorities discuss what it is that we need to do commonly for the future. As we've been on the scene for quite a long time, we also see quite a kind of new incentives or new suggestions how to use the tool. And one of that has been that actually when you do your assessment on a regular basis, like as you can see here, we have the example of this country who done the assessment back in 2017 and repeated the assessment back in 2019. So the tool helps you actually to capture how you evolve in your maturity. So what has improved over those years, or you still are working towards the same gaps. What I would like to highlight about the tool and the hub itself is that I said at the beginning that we've been really working with the diversity of healthcare system within the project, but also with our external community. But the success in using of the tool has been in the fact that it has been designed in a very flexible way in terms of its application. So even though you have the mixtures of the healthcare system, you are able to apply this tool at various levels. So we have experience with implementing the tool on national level, regional level, local level, but also, as I said, like within a small teams or within a particular organization. And I think it's predominantly this flexibility as well as the fact that the users has always been the center in designing the tool and the hub itself has resulted in a quite interest in using the tool. So as you can see throughout the project, we're able to implement or apply the tool in 40 different countries, coming both from Europe and beyond. And we have currently over 700 unique users with almost 1,300 assessments stored on the hub. And just to drill out into the map of Europe, as I said, we've been working with 9 health and social care authorities, but through our external engagement, we're pretty much able to reach almost every EU country or EU member state. So this has been quite impressive in terms of the engagement of Scirocco exchange community. The fact that the tool has been so successfully taken has also resulted in a demand to adapt the tool to different areas. So can we take the same approach we've done for integration and bring it to some additional areas? And thanks to the collaboration with either other EU-funded projects or other universities, we were able to deliver a fully functional 2 versions of expanded online self-assessment tool, one for innovation and one for digital neighborhoods. And again, they are free to use, free to test on the link provided. The second functionality of the map of the hub has been about trying to link or advise the potential users where to look for the evidence to improve your situation. So once you understand your gaps, you've done your maturity assessment, what is there on the market that I can learn from rather than reinventing the wheel. So here we've done substantial mapping of over 1,600 assets to basically see if there are any tangible evidence which we can use in the project for future learning. Over 600 of these assets are now currently linked to the hub, and the way we allow or facilitate the access to the really evidence that is tailoring your local needs is the fact that this evidence is clustered around the maturity level or the assessment scale of the dimensions. So if you're interested, let's say, to move from the dimension 2 to 3, the hub will point you to the asset which is which is kind of like the most tailored one or the most appropriate for you to learn about and then approve. And I think what is nice is that this is very live functionality, so we keep adding the asset, and every user who is on the hub and is interested to share a new practice, share a new, guidance or any other outcome can just do it themselves. So in terms of the future sustainability, we really like to emphasize that we are looking for ongoing collection of these assets. The third activity within the cycle is then the knowledge transfer. So, as I was saying, we know what we want to improve, we understand our gaps, we found the evidence we want to learn from through the hub. And then in order to actually learn about that evidence, we facilitated a number of knowledge transfer activities. And again, we, in this process, we try to highlight that the conditions in every country and region is different. So even the knowledge transfer activities should be tailored and personalized to the local needs. So we had developed 9 different knowledge transfer programs, each for one each for the partners in the project. And in total, we have implemented 26 knowledge transfer activities. And I think what was nice, and we will hear more in the dedicated session on that, is that there has been a really large diversity of these activities. We had partners who really very interested to do some sort of like knowledge exchange workshops online, but also developing their own local hubs, awareness raising materials, training sessions, and so on. I think it's probably important to highlight that we had definitely much bigger ambitions when it comes to knowledge transfer, but due to COVID, basically we spent 1.5 years implementing this program virtually. So the priorities of the regions have also changed slightly. What's like in terms of the ambitions, what we can achieve virtually. But as I said, I think you will hear really still quite powerful stories from the regions on the ground. And finally, the last functionality in the cycle of the knowledge management hub is that all these activities from HCT assessment, accessing your evidence, knowledge transfer, ultimately it should lead to the improvement of your local situation. So for that reason, we have used logic models as a qualitative tool to help us to again co-design, so really involve all the stakeholders on the ground to prepare the future priority planning and more importantly, their implementation. And I won't drill more into detail because as I said, like each session will give you more insights how it looks really for the regions on the ground. Thank you.